Welcome to the Gay Therapy LA podcast, the show that empowers gay men to live their fullest, healthiest lives. Whether you're navigating relationships, mental health, intimacy, finances, career, or personal growth, Ken Howard, a licensed clinical social worker in California, certified psychiatric social worker, and ASEC certified sex therapist, is here to guide you with over 30 years of experience, specializing in gay male individuals, couples, and polycules. As the founder of GayTherapyLA.com and GayCoachingLA.com. And now, today's episode.
Hi, I'm Ken Howard, and welcome to the Gay Therapy LA podcast. Today, I want to talk about flash versus substance, pop psychology gurus versus real clinicians. In today's media-driven culture, it seems that the louder someone talks about psychology, the more we're expected to believe they know what they're talking about. Scroll through social media, watch a TED Talk, or browse the self-help section of a bookstore, and you'll be flooded with catchy phrases and polished branding and picture-perfect spokespeople dispensing bite-sized psychological advice. Celebrities who are mental health adjacent became famous, but for what? Dr. Phil is not a licensed psychotherapist in any state. Robert F. Kennedy Jr. is the Secretary of Health and Human Services with no medical background, who undermines legitimate medical providers with conspiracy theories and aggressive and actually effective misinformation campaigns. He maligns the patients and families of mental health conditions like autism by spreading lies about their functioning in not only an inaccurate but cruel ways that oppress these wonderful neurodivergent people. The head of the Centers for Medicare and Medicaid Services is the vile Dr. Oz, who is another misinformation conspiracy theorist and an especially foul anti-LGBT bigot who is completely unqualified for that job. Dr. Drew is another noted anti-LGBT bigot and self-serving media figure who obfuscates real psychiatric educational information. Other celebrities might not be exactly harmful or toxic, but they're often superficial and not in the trenches clinicians or practitioners of mental health services actually serving patients or clients. So, as a gay man specialist psychotherapist with over 32 years of full-time clinical experience, not just talking about mental health, but practicing it daily, as well as a retired academic who taught at the graduate level actual evidence-based psychotherapy practice models, I can't help but feel that our culture, especially on social media, is increasingly mistaking flash for substance. Let's talk about the rise of the psychology personality. Don't get me wrong, I'm not against accessible language or public advocacy for emotional wellness. It's important for the general public to engage with psychological ideas. But when people like Mel Robbins or Brene Brown become household names, it's worth asking, are they popular because their ideas are groundbreaking or because their packaging is? When someone builds a brand around rules or power statements, it's marketing. When a clinician sits with a client in crisis week after week, helping them untangle trauma or manage relationships or navigate shame or survive a depressive episode or heal from trauma, especially in a culturally competent, culturally informed way, like LGBT affirmative practitioners, then that's therapy. And the difference is more than just cosmetic. Let's talk about how pop psychology isn't therapy. So pop psychology has its place. It can introduce people to ideas they've never heard before. Things like emotional boundaries, shame and resilience, attachment theory, surviving toxic narcissistic behavior, challenging gender or racial injustices. It may even be the thing that nudges someone toward accessing professional mental health services. But let's be clear, it is not a replacement for actual therapy or even informed coaching services, grounded in clinical training and real-world experience that involves either 2 or 4 or more years of graduate training, 2 or more years of supervised clinical training, state licensure, and ongoing continuing education seminars throughout a professional's career to maintain a state license or a specialized credential, like I have with ASECT and the Nationally Certified Sex Therapist credential. It's the difference between an inspirational Instagram quote and the hard work of exploring why you sabotage your own relationships, for example. It's the difference between hearing, "Oh, just do it," and actually learning how to manage executive function from ADHD, or how to operationalize behavioral goals in a clinical social work context. It's the difference between a soundbite and a professional clinical working relationship. Let's see what the research says. So according to Lilienfeld, Lin, and Lohr, in Science and Pseudoscience in Clinical Psychology, this is back in 2014, the rise of psychological entrepreneurs risks diluting public understanding of what mental health care actually is. Oversimplified, untested advice can give a false sense of security, or worse, delay people from seeking the actual professional care that they need. Pop psychology personalities often bypass ethical codes, licensure requirements, supervision structures, and research evidence-based, proven psychotherapy practices. And while their advice may be emotionally resonant, or popular, or feel good, or entertaining, it can also be misapplied, or poorly timed, or even damaging when presented as a substitute for therapy, which it isn't, but it can be implied that it is because of a lack of disclaimers of its limitations. Therapists acknowledge and discuss the limits to their scope of practice or training most of the time. Pundits and gurus and celebrities almost never talk about the humbling aspects of the limits of what their content is. Whereas a therapist will tell you if he or she or they is not qualified really to speak to a certain clinical area. For example, I don't work with teenage girls with eating disorders. I'm licensed to, but it's too far out of my scope. I just don't know the psychology of adolescent women and eating disorders. I've worked with gay men with eating disorders, but every therapist, and I think it applies to physicians as well, needs to acknowledge that they can't be all things to all people. There isn't time in one career to study everything in sufficient depth. This is why I'm a gay men's specialist therapist, is because trying to explain, gee, what's PrEP and what's doxypep and, what's a side and what's a top, there just isn't time for every mental health professional to become a specialist in every single area and serve everyone. If you try to serve everyone, you really end up serving no one especially well. So remember that therapy is a relationship, not a hashtag. Unlike what you find in most self-help content, therapy isn't just about inspiration. It's about transformation. And transformation takes time, vulnerability, skill, and often some pain, or at least some discomfort around making changes to your thinking or to your behavior. It requires a professional who understands pathology, human development through the lifespan, neuroscience and neurobiology, a social context, things about attachment theory, things about cultural competency or personality structure theory, or social stressors, or historical context, or the ethics of interpersonal care services. So clients often say to me, I've worked with therapists before, but this is different. And what they mean is that this is deeper, more direct, more integrative, more informed, more gay affirmative, more seasoned, less stigmatized, and frankly more human. There are no mantras or magic rules or super easy fixes here. There's nuance. There's lived gay male experience. There's empathy, science, skill, and accountability. Sometimes they're even spreadsheets. If you've ever worked with me on career coaching, you know what I mean. Therapy doesn't promise clarity in 5 seconds or the length of a TED Talk or the length of a self-help book or workbook or a weekend workshop. But it does provide a long-term space for rewiring maladaptive coping mechanisms, healing from psychological trauma, changing deeply rooted relational patterns in your life, working through grief or fear or anxiety or shame or loss, and challenging cognitive distortions with empirically validated techniques, and learning what cognitive distortions are, how we use our own mind against us, but how we could, with some practice, use our own mind for us. And that's what cognitive therapy is, and reframing negative cognitions or negative thoughts to more positive ones, more functional ones. So research-informed practice becomes invisible to the client, but to the trained therapist, it's there. It's underneath. Clients don't see the thousands of hours of training or the thousands of pages of books and articles that are read, or the dozens of hours of clinical supervision sessions and case consultation, or the depth of research in your average session. They just don't see it. Or the thousands of hours of lived experience and observational data from helping other clients, particularly over a long period of time like me, 32 years of seeing almost exclusively gay men. And it's all there in the back of a therapist's mind for everybody, which increases with every year of experience helping real people day in and day out, especially in a full-time or even in a part-time private practice. Self-help content might tell you, oh, don't let anyone steal your power. But a therapist will help you unpack why you keep giving it away and guide you through the work of reclaiming it. Let's talk about how coaching is also more than just a pep talk. Even coaching, while it's technically non-clinical, it's not a healthcare delivery service, it's still a structured, goal-oriented, professional working relationship. So coaching involves, there's a lot of overlap and there's a lot of discussion and a lot of crap about, therapy is about the past and coaching is about the future, and that's really just marketing for coaching. But coaching involves tools like your values clarification, clarifying your values and your purpose and what's important according to you. Not everybody values the same things equally. It's about strategic planning for your career or for your life or your relationship or your finances. It's about skill building, not knowing how to do something and finding yourself through coaching work to be able to do something. And behavioral accountability. AA says nothing changes if nothing changes. There needs to be a little bit of accountability or you don't move the needle in making progress on a problem that you're trying to solve or a situation you're trying to improve. Coaching is not regulated, by the way, in any state by a state body or a state licensing board, but the professional associations in coaching do give some structure to the delivery and the ethics and the consistency of coaching practice. So an experienced coach isn't just cheerleading or, repeating slogans, but they're helping you define actionable steps toward complex outcomes, making a career transition, honing executive management skills, improving interpersonal relationships with many different kinds of people, such as in the workplace, cultivating presence, leadership development, dating success, sexual education, or building a small business. I have a whole video webinar on that on the Thinkific platform and how opening your own business can be different for gay men. But that's a start. Ongoing coaching, as I both received and given for hundreds of hours over decades, that can really help a business to thrive for the long term. So unlike pop gurus or chatbots, coaches don't assume your goal is, be happier. They help you define your goals and then work collaboratively with you to achieve them using methodology, expertise, and strategy. It's still work. It's interpersonal, professional work, but it's tailored to you, it's collaborative, and it's grounded in professionalism, not the popularity of some guru. The real work of therapy or coaching is much more expensive than self-help, sure, but that's because it is, the actual work that is live and interpersonal and takes place in real time in sessions. The social challenges of accessing therapy or coaching are another issue, but it's something that is constantly debated because people need these services, but they often face barriers to getting them, particularly financially. Usually because of the problem of greed in insurance companies who have multi-billion-dollar profits, or more recently, the problem of greed in mental health venture capital startup apps, which are not a substitute for OG therapy. Let's talk about the real life comparison, TikTok advice versus real therapy. So let's take a case example. Let's say a client, I'll call him Evan, is a 42-year-old gay man who is struggling with recurrent burnout and relationship dissatisfaction. He stumbles on a viral video that says, "Set boundaries and cut off toxic people. Your peace is non-negotiable." Okay, that feels empowering for a moment. But when Evan tries to do this with his emotionally complex, personality disordered mother or his trauma-surviving long-term partner, he's overwhelmed by guilt and fear and a sense of shame. The slogan didn't prepare him for that. So, he comes to therapy. Over several sessions, we explore Evan's attachment history, his early caregiving experiences, his family of origin, or even what's going on in his family of choice as an adult gay man, and peer dynamics that somehow taught him to equate love with self-abandonment, giving away too much, losing a sense of self. So we might identify how perfectionism or giving too much masks his own fear of abandonment. We role play and we rehearse language and assertive communication for setting boundaries without aggression and without shame. It's somewhere in the middle between passive and aggressive. It's just assertive. And we validate his grief and we help him to tolerate ambiguity in relationships. Real relationships are complex. They're not all hero and all villain. We strategize plans. We look at changing thoughts and slowly changing habits and cultivating routines for a better future. And maybe, perhaps the second half of his life is better than the first half. That comes up a lot in my work with both therapy clients and coaching clients because a lot of guys come to me más o menos around age 40. A few years on either side of that is the peak time for people to become my clients. And what is that? That's early middle age, right? Depending on what you really count. But for somebody who's 42, like Evan, that kind of applies. Where no matter what he's been through, maybe it's been trauma, and maybe it's been through hell as a young man who was bullied and just not very happy, but maybe doing some work on himself at midlife helps him to set the tone for him growing into an older and older and older man with actually a better and better quality of life. So the Instagram clip gave our Evan a push, but therapy gave him the tools and the healing to actually make change. Real behavioral change about just about anything takes time and practice and coping with relapse and renewing the commitment to behavioral change with the help of a social support system. This would be true about coping with psychiatric symptoms like depression or anxiety or compulsive behaviors or obsessions. It would be true about losing weight. I work with guys sometimes on the mental health aspects of weight loss when they might work with a trainer or a nutritionist and certainly their doctor about the medical side of that. Or changing skills to increase your career or increase your income or your impact or your level of work satisfaction. Or somebody in recovery from a substance. Behavioral change when it comes to alcohol and drugs really takes time and practice and learning how to just live differently without self-medicating with some kind of substance. So all of that, it's a process, not an event. It's not a quick fix. It's not a buzz bite. It's not a meme. It's not even a self-help book. Even though I wrote a self-help book, it's meant to be an introduction. It's not meant to be the work itself. If you're interested in that book, by the way, it's called Self-Empowerment, Have the Life You Want, how to get from where you are to where you want to be in important areas of your life, your mental health, your finances, your relationships, your sex life, and your role in your community. Self-Empowerment, Have the Life You Want. So I'm not telegenic. I'm an older gay man, and I realize that. I don't market myself all that often through viral reels or stage managed sound bites. I do it a little bit just to get the word out. And, I'm frequently coached that that's how to market my practice. Online visibility, uniqueness, the entertainment factor, the personal relatability, and appearance. What does this guy look like? But for 30 years now, I've worked privately, quietly, deeply, somewhat invisibly, one case at a time with individuals or couples or polycules, and occasionally families or groups, with real people in real pain over real time. Many of my clients are high-functioning gay men. They're executives, they're creatives, and professionals with complex lives and high expectations. They don't need hype. They need results. And what's disheartening is how often legitimate clinicians and coaches are passed over because we don't package our substance in splashy formatting, or we're not made famous because, Oprah said so. Meanwhile, media darlings without state licensing, without formal clinical supervision, without ethical constraints, amass these thousands of people as followings for selling oversimplified mantras that can leave vulnerable people confused or even harmed, certainly isolated. In a world that rewards charisma and even superficial beauty, it's easy to assume that visibility equals credibility. And yet the most effective clinicians that I know rarely have Instagram followings in the tens of thousands. They're too busy doing the real work, sitting with pain, navigating ambivalence, empowering growth, and holding space for personal transformation with everybody that they work with, almost every hour of the day. So, in my closing thoughts, trust the work, not the hype. Real therapy and real coaching require an investment of time, of money, of trust, of effort. But that investment returns something that no celebrity guru soundbite ever could. Actual growth, actual insight, and actual healing. Changing your life for the better in a way that is lasting, that you get to keep long after the initial investment is over and long after some guru's 15 minutes of fame are long up. So if you're tired of influencers telling you who to be, maybe it's time to discover who you are through work that's structured and confidential and consistent and grounded in your lived experience, not someone else's curated brand that's the talk of the internet this week. You deserve more than flash. You deserve substance. And I'm here when you're ready. For more information about working with me, call 310-339-5778. That's 310-339-5778. Put an 01 in front of that, I think, if you're in another country besides the U.S. I offer online therapy on the Zoom platform for residents of the state of California, where I'm licensed, and offer coaching worldwide. We just figure out the time zone. More information is available at the websites, gaytherapyla.com or gaycoachingla.com, and that will explain more of the differences between those professional services, and that's something that we can talk about when we meet. You can also reach me email. Some people like calling or texting. Some people like emailing. So the email is ken@gaytherapyla.com. So thanks, and I'll see you next time.